First time in 5 years, new data from the Centers for Disease Control and Prevention shows opioid overdose deaths in the U.S. declined. Our Christina Burgess spoke with local doctors and advocates on what's behind the trend. And Christina, what did they tell you?
Well, Anthony, they tell me that it's a significant shift health professionals and advocates like to see, pointing to a handful of reasons, including accessibility to Narcan.
We're happy to hear that that number has dropped.
84,000 to 81,000 are the numbers Dr. Christine Caulfield is referring to. They represent the drop in overdose deaths from opioids like fentanyl from 2022 to 2023, according to the CDC. It's a decline Dr. Caulfield says is due to improved access to addiction medication like Narcan and investment in resources from the state and federal government.
We need to ensure that there is access for individuals that are suffering from addiction, that they get the help that they need.
Helping people suffering from addiction is what TJ Ward does as Director of Advocacy with Project Opioid. Through their work of coalition building and offering life-saving resources and high-level advocacy, he's managed to reach students and others throughout the First Coast with seminars and testimonials of those impacted by overdoses.
So we're able to gather community members, let them know what the current narrative of the overdose crisis looks like and what they can do to be a part of the solution.
While advocates and health professionals are happy to see a decline in the death toll, they don't want people to let their guard down.
We must be cautiously optimistic, and we got to stay vigilant because these things ebb and flow.
Florida saw a nearly 8.5% decrease in reported overdose deaths from 2022 to 2023. Georgia reported a 7.9% decrease during the same time period, both states higher than the national percentage of 5.1%.
We can't keep our eye off that ball. We must continue addressing the addiction problem that we have in this country.
And now, while these opioid deaths are falling, according to the CDC, deaths from other stimulants like cocaine and meth are continuing to still rise. Cocaine-related deaths rose 5%, and deaths from meth rose 2%. Christina Burgess, First Coast News, on your side.